he's putting me in the dock. Now I think I've got the red card in everybody's pocket. But actually it's an amazing setting, and I think it's really fitting that this is where we're discussing evidence-based physiotherapy. Probably I should say from the beginning, Roger used WCPT. Now, I don't know that everybody in the room knows WCPT. There's cards on your seats. It's the World Confederation for Physical Therapy. So those of you from the UK, if you're members of the Chartered Society of Physiotherapy, you are part of a global, worldwide profession through WCPT. And I think it's important to say that from the beginning. I'm also going to introduce you to the rhinoceros in the room, which apparently some philosophers like the phrase of. Talk to us later, and I will introduce and say why he's here. But my first confession, and I think since I feel as if I'm in the dock, is this is an opinion piece, the lowest form of evidence. I also think I'm my own confounding variable, because when I was challenged to think about this, about what evidence-based practice was going to be, I wonder if my own reflections have been shaped by what it's become. Because I think you need to ask me back then what I thought, as opposed to what I think now. Whilst it's coming. More confessions. Right from the beginning, I'm a strong advocate for evidence-based physiotherapy, and have been from the beginning. I wasn't alone in that. Through the Chartered Society of Physiotherapy, through staff, through members of the CSP Council, through the committees there working on research and development, people saw from the beginning what was happening around evidence-based medicine. The definition is one that you know really well. The overlapping circles is a really well-known image in terms of presenting it. And I think few people at the time disputed the fact that those were the essential ingredients for sound decision-making in the interests of patients. I also wrote an editorial at the end of the 90s in the Physiotherapy Journal, which was around evidence-based physiotherapy and survival of the fittest. The profession had to change, it had to adapt, it had to be fit for the future. As part of this exercise, I went back and reread it, and I cringed. Because it was really gung-ho, I think. Now you could say that's what it happens sometimes at the beginning. You don't necessarily think it through. Sometimes you buy into something because it seems to make sense right from the beginning. So I think those are my confessions out of the way. But I actually still really like this image from 1998. I think as a profession, from the beginning, we knew that practice was messier than 3 overlapping circles. It was all about the context of decision-making and the values that come into that. And Roger's already mentioned that in terms of patient values. We as physiotherapists in any interaction have values as well, as does society. So if we're talking about it from a political agenda, there are values that come into it. Our clinical experience shapes the way we even interpret the evidence. So whilst the evidence may be put in front of us, we're still contextualising it. So when I say being a strong advocate for physiotherapy and what it should be, I'm talking about it in a slightly messier way than 3 overlapping circles. I'm going to make no apologies here for using a hierarchy to help frame the talk. The hierarchy's already come up. So I've used some phrases here because I think the most important thing, the most impactful thing for the physiotherapy profession 20 years ago was that people very quickly bought into the fact it was a necessity. It was something we needed to be doing as a profession. It was about our professional identity, that we should own it and lead it and be accountable for what we did, as well as respond to external factors like political pressure, pressure on resources, both human and financial, from an economic point of view from government, as well as local commissioning. With it came huge opportunities for the profession, and I think people very quickly saw opportunity over challenge. And I think as a profession, sometimes we can see the challenges more than the opportunities. But I think when evidence-based practice was starting out, people could see how we could open doors. We could sell the value of physiotherapy. We could influence the research agenda. we could grow the capacity and capability within the profession to generate research that mattered to us and mattered to our patients. So I think this was about owning the agenda. And I think that's something, as a professional association, the Charter Society of Physiotherapy did early on, was actually take responsibility for leading from a professional level. It wasn't without its challenges, and those challenges haven't necessarily gone away. They may well have shaped. But I think one of the biggest challenges we faced as a profession 20 years ago was the extent to which we talked about guruism within the profession. There were named approaches to what we did, particularly in neurology and musculoskeletal fields. People described them in the terms of the name of someone, not necessarily unpacking what was in those component parts. So if we were going to influence the agenda, if we were going to be valued for what we did and not what we were as a profession, because that's where some of the research was. I remember being at the CSP having to write letters off to the BMJ. You can't say physiotherapy is ineffective in a trial. You're talking about a profession. You're not talking about what we do. So we had to own that and start unpacking what we did. But I think it was less of a talking point. So Roger started with it being a talking point by setting off the day, and obviously we're here. But I think 20, 25 years ago, the talking point wasn't so much about what it was going to be, it was just we had to get on and we had to do it. There was an imperative to it. So information overload was one of the biggest challenges everybody was facing. It was the days, this is age showing, before the internet had really exploded and the resources were there, but people had a vision of what evidence-based physiotherapy could be, evidence-based medicine. It was going to be the handheld device at the bedside. At those times it was talked in terms of the professional device, personal device, rather than the smartphone. The smartphone didn't exist. So, when we think where we've come to, there was a certain element there, but you needed to have the content for that. So there was the Cochrane collaboration, and very early on we got Ian Chalmers to come and talk at the Charter Society. There was also the work of Rob de Bie from Maastricht in the Netherlands and Ricky de Vet with the rehabilitation and related therapies field. It doesn't exist anymore. But back then, it did exist to try and develop the skill sets within physiotherapists around randomised controlled trials and systematic reviews, because people were buying into the evidence and we had to generate that evidence. Cochrane was already steamrolling ahead and had gained a momentum early on, but many of those reviews did not have physiotherapists involved in them. So the physiotherapy component of a patient's pathway through particularly long-term conditions as well as acute things was missing that professional perspective. So a field was created in order to upskill people and then to disperse them amongst the Cochrane reviews. And again, as a sign of the times, that no longer exists because people are bedded into that reviewing process. So along with external initiatives, and Cochrane was one of those, there was also the NHS Centre for Reviews and Dissemination at the University of York. And they were producing things like these effectiveness bulletins. So these again from the end of the 90s, early 2000. And as a society, taking that professional lead, it was really important to try and get physiotherapists involved in these, because this is what commissioners were using. It was this type of resource that was going out there to shape opportunities. Globally, there were things happening as well. So there was the Centre for Evidence-Based Physiotherapy in Australia. That still exists, and that's now generating PEDRO, so the Physiotherapy Evidence Database. And that's grown, and now many associations professionally around the world are helping to support its sustainability. It is still focused on randomised controlled trials, systematic reviews, and has expanded to include guidelines. There was a landmark meeting held at Charter Society of Physiotherapy, 2001, led by the World Confederation for Physical Therapy. And this was one of my first forays into the global picture. And this stemmed from a discussion in 1999 in Yokohama in Japan, where there were some people from different associations. I think it's one of the first times Emma and I probably met. And it was saying, well, yes, elsewhere people were saying, yes, we have to do this, but the profession needs to own it. And there's huge opportunity if we can collaborate and avoid duplication of effort and try and pool resources. So a meeting was held in London. It was a lot about sharing different people's perspectives, the agendas that they were being challenged by. Resources at that time limited, and I would say resources now still limited. But some mapping work was done to try and find out what the associations were doing to lead, what the priorities were in different countries, and to try and create a pool and a gateway to information. I actually brought some evidence with me, and I will submit it. This is what physiotherapy frontline used to look like. There's probably some people in the room who do remember it. It was quite a hefty weight. You can tell how old it is because it has yellowed inside. Luckily I didn't open the page for my picture because I definitely have yellowed as well. But this was a landmark, I think, move to actually get much more debate around clinical effectiveness, research, and the evidence base into mainstream publications coming out to the physiotherapy profession. Because the lead from the society was really about empowering the profession to own the agenda, empowering individuals to be leaders and to bring influence. So you could say that really was around advocacy efforts. So a number of projects were initiated to produce physiotherapy effectiveness bulletins. And again, these are the early ones. Again, because of resources, it started by drawing on randomised controlled trials and systematic reviews. Limited resources so often put the scale and the scope around activities. These were there helping clinicians to get some bottom line information out there that they could hopefully read over the coffee break if you ever had such a thing as a coffee break in a busy physio department. The other avenues that we used, which I think were really important, was developing the research and development agenda. So we had a number of opportunities to influence government, and it was UK-wide at that time. It wasn't dispersed into the different nations. So there were things like developing research in the nursing and allied health professions. We were knocking on numerous doors to actually say, if we're going to really own and move forward evidence-based physiotherapy, we need infrastructure funding to actually support the development of researchers as well as the appropriate research in the first place to inform evidence-based physiotherapy. And that was heard. So there were various initiatives that looked at funding streams to develop capability and capacity. From that, there was also the work through the society to define research priorities. Because out of all of this, if you go and look for funding, you're already constrained by the way in which those funders frame their funding opportunities. So the CSP has done, I think, 3 exercises now over the period of about 20 years, looking at what the priorities are within the profession. And that opens doors, and that opens funding opportunities, because if you show you've done it in a systematic way, it's more receptive. At the same time, you're still playing a game. So you're not necessarily getting at some of the softer stuff. You are getting much more at the classic medical model. But sometimes you have to start somewhere and to have the credibility and to get that funding. The other thing that was done was a whole load of road shows going around the country, which I think were enormously successful. They were really popular, and they took clinicians on the journey of tools and skill sets development. This was at a time when the new graduates were only just coming out of degree programs. Majority in practice were diploma qualified, and it was about how could we capitalise on the new skill sets that was coming out from a degree-led profession, but also give the tools to clinicians to have the right conversations amongst themselves about how they change and approach what they do, but also to go out and market, for want of a better term. So there was a lot of emphasis on critical appraisal skills, how you go and find the evidence, what type of evidence you're looking for, how do you package that to think about changing your practice. So what do I think it's become now, sort of 20 years on? It's my hierarchy again, but actually I think there's a bit of a flip here. So I think everything has matured, and I think it is still maturing, and that's not just some of us as individuals, but the actual quality of the discussions that we're having. We are more ready to challenge ourselves as a profession. And I think you have to have evolved to a certain point to come out and stand as a profession on your own and be ready to ask those questions of ourselves in an environment like this, for instance. But also, this is taking place on Twitter now. You know, that's a big development. I walked in the room and I'm thinking, do I hug you or not? Is it just a face off of Twitter? But actually it just shows the quality of the ways in which we're interacting. I'm an eternal optimist when it comes to evidence-based physiotherapy. You can get browbeaten, but I'm going to still say there's huge opportunities. And I think, hopefully Emma's going to touch on this a little bit, is around the global nature of the profession now. The interconnectedness that we have, I think, creates enormous opportunity to have impact. Still challenges. Challenges are all tied into those talking points. And I think it is about looking at some of the methodological questions. I think that's where we're now at. In the past, there seemed to be the divide, qualitative, quantitative. I thought that had blended quite early on, but I still think there are challenges. Plus the dimensions of research methodology have changed, the blended approaches. But I think there's still a focus on doing the right thing at the right time, in the right way, taking into account that whole contextual aspect of practice, whether that's making decisions around individual patients or clients, because they're not all patients, some of them it's the wellness side, or it's about the population. I've put necessity at the bottom, partly because I think everything has moved on and people have accepted that. However, I'd also challenge us as a profession. The number of books that now exist called evidence-based in physiotherapy. Do we still need to label and use that phrase all the time in what we do? What else is it that we do the rest of the time? If I drive my car and I have a car sticker in my car that says baby on board, what does that mean? What message does it send out? Does it mean I'm going to drive really carefully because I've got a special package, or to the person behind, treat me, you know, look after me, don't come and drive into the back of me? If I take the sticker out, does it say, okay, bash into me, or I'm just going to drive more recklessly because I haven't got a baby on board? I think we have to think about why we're using messages and why we're using labels. So is it helpful to all the time refer to evidence-based cardiorespiratory, evidence-based musculoskeletal? And I just put that out there as part of the challenge and a talking point. Love them, hate them, impact factors of journals. I think they do show the growth within the profession in terms of its research capacity, how it's pulling its punches, because it's an external factor. It can impact on the research funding that you can get within the university environment and from external funders as well. It's all part of playing a game. And I think right from the beginning, you have to sometimes think whether you're in the game. And if you're not in the game, can you change it from the outside? And that's just something I put out there. So in terms of have we got better at sort of gathering the information and disseminating it, I think the information landscape has changed. So we still have Pedro. Pedro is now translated into numerous different languages, so it's still connecting the profession. We have resources, I've just used another example here from the American Association of Physiotherapy, Physical Therapy, which is around PT Now, around clinical summaries derived from the evidence, but it's in their member-only access area. There's Physiopedia, which most of the physios in the room will know, the Wikipedia for the profession, but I would say somewhat more organic. Still has that intent about the profession owning the evidence base. You'll still get into quality issues, the nature of what's actually there, who's actually contributing, but that was something that came from within the profession itself. Then I think this is a change from the Charter Society, and I think these series is great. I think it's been going out on the road. I think it's hugely influential because I think the shift has been from looking inwards and producing material to really influence the individual physiotherapist and to get them to challenge their own practice, to be much more outward facing. And that's why I say I think the profession has bought into it. We have to say what we do, why we're actually here, and why it matters that it's us doing it. And that's as much to our professional colleagues, to other health professionals, to ministers, to those that are commissioning, but also to the public. The public are much more discerning in their own choices. I know we used to laugh when I mentioned, your patient's going to come and turn up with a printout from the internet and challenge you as to what you do, and people say, well, that's just not going to happen. I'm one of those patients, I can tell you. If ever I have to go with one of my children, it's, I've got the list of questions that's there. So I think this has now got to a language that's more accessible. It's bedding the evidence in rather than the evidence, all the references being there. It's still behind all of this. But I think it's now, as I say, become outward facing. The train has left the station. Evidence-based physiotherapy is here. But I think that's what's important. It is here. We are doing evidence-based physiotherapy. Lots of people jumped on the train at the beginning, and I was one of those. There was a straggler down here, that could have been Roger. Or it could be somebody jumping off, whatever way you look at it. But I think we have to look at the whole landscape within healthcare, what's happening within other professions, and not just within physiotherapy. I think we can also recognise that the landscape changes. We really are reflective of the environment that we're actually in. So then and now, is it that much different? I think it is. I think the profession has grown and matured a huge amount in the types of conversations that it's actually having. I think we own the agenda now more. I think we're still influenced by external factors, but in some ways perhaps we're less compliant with the external factors and influencing perspectives. I think we are looking outside the profession, so I think this is a really good example, looking at the philosophical framework that's actually there. This is not a book plug, because it's 20 years old, it's out of print, and I had to dust down the cover when I took it off the shelf. But a couple of things struck me actually. It was right from the beginning, was about balancing the needs of the individual against the needs of the masses. And at the time of writing it, if you look at how it's written in here, it's probably more in terms of the economic and political context. But I'm going to say now it's much more about the decisions that we make for our individual patients, as well as when we're talking outwardly for that political and societal discussion. The other thing it made me think about was that I gave a copy of it to my father-in-law at the time, and he's a retired consultant pathologist. And he said two things to me. He said, one, I don't think I can practice in that world. It used to be the world where the doctor told the patient what to do. And the second thing he said to me was, you're a philosopher. And you know what, at the time, I didn't know how to take that. But actually now, I see that as a huge compliment. So I thought that was just a really interesting reflection once I went and dusted this down. So I still remain a firm believer in evidence-based, context-sensitive decision-making in practice. It's a few more initials than EBP. And I think that picture that I put up at the front about it being messier than 3 overlapping circles still holds true. I was a proponent of evidence-based physiotherapy. I still am. But I think we own the agenda and we can shape it. And that shaping is going to continue from here on in. And I hope that's the discussions that you'll have today. So hopefully the red card hasn't come out.
Thank you.
Thank you.
Brilliant. So we just had a great talk from you, Tracy, on where evidence-based medicine has come from and where we're up to now. We just wanted to get your thoughts on where you think evidence-based medicine can go.
In terms of where it's going to go, I think that's up to the profession to define the agenda. Research generation has often been driven by individual physiotherapists' areas of expertise, their own questions, and I think we're getting better now at getting practice-driven research. There are many health agendas that are set by politicians, by health economists, by society at large. And I think we have to strike the balance from generating the research to influence those agendas, as well as determining what the agendas should be, and us taking a lead in determining that based on evidence we generate.
Brilliant. And I think you said it very nicely. I think at some points we may have forgotten where the patient was in the journey. Have you got any thoughts on how we might bring the patient back in?
I think we have to see that as a professional responsibility. I think one of the first questions in an interaction is, why are you here? What do you want to get out of it? And it's over 20 years since I've been in clinical practice, but being on the other side of it as a patient, I want someone to really understand why I'm there. Although it's interesting, I was involved with a Twitter chat around this sort of issue. We had some patient representatives there, and they said actually the patient doesn't always know what they want out of the interaction, so you have to take them through a structured approach to help us understand what it is we might need. So I think we have a professional responsibility to focus on the patient. It's, at the end of the day, the goals that we're trying to achieve should be a shared vision.
Yeah, that's brilliant. Thank you for asking my questions. I'll let you go and finish your
All right,
coffee.
thank you.